One of the things that we want to also highlight is the reproductive rate of the virus. And we have a slide I want to show you right now, if we could pull that up. And one of the indicators that we watch in the task force and in the task force briefings we discuss on a regular basis is the reproductive rate of the virus. And that means for every person who has COVID disease, how many new cases are they going to create? And the baseline at 1 means a person with COVID would infect and create 1 new COVID case. If the reproductive rate of the virus drops below 1, then each new case creates less than 1 new case. And there have been 2 time periods where we had in Shelby County and surrounding areas, the reproductive rate pushed below 1. The first was last July, after the initial face masking orders went into place across the county and throughout the city of Memphis. And that, just simply wearing the mask, drove the reproductive rate of the virus down by interfering enough with the transmission of the virus that RT, or reproductive rate, dropped below 1. And we held it there for a long time, but then as we headed into October, at the end of September, it came back above 1. And so from that point, when we went into October until January, the reproductive rate was above 1, and that was when we were having that great surge of cases that took us through Christmas and New Year's and Thanksgiving and all of that activity in December and heading into January, where we had such a big surge of cases. That was because the reproductive rate of the virus was above 1, and each case was creating more than 1 new case. In other words, the epidemic was growing during that time. But then after the first of the year, reproductive rate dropped below 1 once again. And it stayed there for most of January, all of February, and most of March. But now we are back in a time phase where the reproductive rate of the virus is 1.14, meaning each case creates 1.14 new cases. We are once again growing the epidemic. And so in spite of the fact that we only had 65 cases reported yesterday, we know that in fact the epidemic is growing. That is what we're concerned about, and that's why we want to remind everyone of the importance of always wearing a mask when you're in public, when you're around people that you don't live with and who are not vaccinated, or you don't know whether people around you are vaccinated. Anytime you're in public settings, at work, shopping, or out and about, it's important to have a mask on to limit your exposure to viruses from someone else and to limit them from being exposed if you inadvertently are shedding virus and you don't know.